Well, good afternoon, everyone. It's a pleasure to have everyone join this afternoon, and I would like to be the first person to welcome you to the Virginia Funders Network webinar this afternoon on Virginia's response to the ending of the public health emergency. I'm Robin Mockenhaupt, and I am the Director of Policy and Advocacy for Virginia Funders Network. And I am have been looking forward for a long time to this session this afternoon. So I'm really delighted that so many people were able to join us today for this conversation. Welcome. So many of you know, as VFN members, that what we are about in Virginia Funders Network is to build a connected, collaborative, philanthropic community to provide opportunities for everyone who calls Virginia home. That's really particularly important for our topic today in talking about the ending of the public health emergency, which is to think about, for all those people who call Virginia home, what their opportunities are as this public health emergency ends and what our role as funders are in this process. So that's what we're going to be talking about today. We have fabulous speakers, a great session ahead. And at the end, we will have breakout sessions to break into regional conversations for you to talk to each other about what you're doing and what others are doing in your region. So we're really delighted to get started. And I have the pleasure of introducing our moderator today, and that is Avenel Joseph, who is going to be leading us through the conversation this afternoon. And there are three things that I want to tell you about Avenel Joseph. The first is that she is Vice President of Policy at the Robert Wood Johnson Foundation. And she leads the policy unit at RWJ and also heads up our Washington, D.C. office and presence in the Northern Virginia area. She's a key member of Robert Wood Johnson Foundation's senior management team, and she really is the inspiration and the guide behind the commitment that the foundation has to help everyone lead a healthier life. So that is her role. The second thing I want to tell you about Avenel Joseph is before she started at Robert Wood Johnson Foundation in 2020, she had 10 years experience up on Capitol Hill and was involved in shaping public policy both in the US House of Representatives and in the Senate. And she ended her career on the Hill in Senator Markey's office from Massachusetts as his Director of Policy and Oversight. She's a scientist by training, and she believes in the importance of evidence-based and data to really ground and lead policy. And the third thing I want to tell you about Avenel Joseph is that she is a wonderful colleague that I had the pleasure of working with very briefly before I left Robert Wood Johnson Foundation, and a great leader. And I'm really delighted that she is our moderator today. She's going to tell us more about the session, the purpose, our speakers. And so Avenel, welcome, and I'll turn it over to you.
Yeah, thank you, Robin. We worked together for too short of a time. But it was a very much a pleasure of my life, and appreciate being invited to do this today, to be with all of you, and to moderate this session. As we all know, during the COVID-19 pandemic, the federal government issued a public health emergency declaration. And with that declaration came some key policy changes for programs like Medicaid, SNAP, TANF, among others. In culmination, these changes helped to get more people the assistance they needed during a particularly volatile period of time, ensuring people could maintain health insurance coverage, afford essential food and supplies, and keep a roof over their head. These policy provisions were tied to the emergency declaration that was extended several times and officially expired on May 11th of this year. The ending of the public health emergency initiated a series of steps and deadlines to unwind these pandemic-era policy changes. However, the Consolidated Appropriations Act that was passed in December of last year essentially uncoupled the continuous enrollment Medicaid requirement from the public health emergency. And beginning in April of this year, states, for the first time in more than 3 years, would have to take a fresh look at their Medicaid rules and redetermine eligibility for every single enrollee. States were given 14 months to complete this process, but many states have chosen to essentially purge their Medicaid rosters on a much faster timeline. As many of you know, redeterminations can be a complex endeavor, particularly restarting that process after years of pause. In several states, the outcome has been that tens of thousands have lost coverage, not because they have been deemed ineligible for Medicaid, but because of procedural issues like a wrong address or paperwork mistake. In neighboring West Virginia, for example, more than 60,000 people have lost Medicaid coverage over the last several months, but more than 80% have been disenrollments due to procedural reasons, not because of a determined lack of eligibility. As Medicaid enrollments continue to play out over the next several months and data is collected on how those outcomes happen, so will the unraveling of PHE or the public health emergency era SNAP policies. Things like college student exemptions, time limits on benefits and recertifications, as will the ending of state-based changes on cash assistance, such as elimination of work requirements and extended time limits for receiving assistance. All of these changes of policies will come to a complete end. And so today we're going to hear from a range of experts who are working in the state of Virginia on these changes to the programs and on their outcomes. The purpose of today's session is to discuss the ending of the public health emergency and what those changes mean for Virginia residents. To discuss why Virginia funders should be involved in working with state and local governments as these social service programs return to normal operations post the public health emergency declaration. To provide a current update on the rollout of Medicaid re-enrollment process. We have several months of data now in Virginia, so we'll be able to provide an update on what's happening with Medicaid, and to provide a current status update on what's going to happen with SNAP and the TANF programs, what has happened and what will happen in the coming months. And in our breakout session, which will be happening by region, we'll be able to discuss the connections between funders and government offices by region, dig a little bit deeper, share funder ideas, share some examples, and hopefully share some helpful practices. As a reminder, we have 4 breakout sessions, which you have either signed up for or which have been assigned to you when you were registering for today's learning session. They are the Hampton Roads region, which will be facilitated by Jessica Mullen from the Obice Healthcare Foundation. Central Virginia region, which is going to be facilitated by Valerie Liggins at the Cameron Foundation. Northern Virginia region, which is going to be facilitated by Sarah Hashmal at the Morris and Gwendolyn Caffritz Foundation. And finally, the Southwest Valley region, which is going to be facilitated by Jessica Wergo from the Community Foundation of the New River. We are honored to be joined in our large group conversation by an incredible cadre of expertise. From the Virginia Department of Medical Assistance Services, we have Kelly Pauley. She's a Director of Eligibility and Enrollment, as well as Natalie Pennywell, the Manager of Community Outreach and Member Engagement. We also have Emily Roller, Director of Health Insurance Initiatives with the Virginia Healthcare Foundation, Michelle Thomas, the SNAP Program Manager for the Virginia Department of Social Services. Their full bios are going to be entered into the chat box so you can learn more about their extensive expertise and career history. Our intention today is to keep the presentation short and the opportunities for questions and for discussion and for conversation robust. So if you have any questions or comments, I encourage you to put them in the chat. I'll help to pull them forward for our panelists to respond to. You can also use the raise your hand function if you'd like to ask your question live. After our large discussion, there will be a transition to the regional breakout sessions, and that will all happen by magic. I'll talk you through what that will look like at the end of our large group discussion. With that, I'm going to turn the mic over to get us started to Kelly Pauley and Natalie Pennywell from the Virginia Department of Medical Assistance Services.
Right. Well, good afternoon. My name is Natalie Pennywell. I'm the Outreach and Community Engagement Manager at the Virginia Department of Medical Assistance Services, or Virginia Medicaid for short. And I am here today with my colleague, and I'll let her introduce herself, and then she'll actually go ahead and get us started.
Okay, I'm Kelly Pauley. I'm the Eligibility Enrollment Manager. I've been here at DMAS for about 12 years. Next slide, Natalie. As you've been told, states were required to maintain enrollment of Medicaid members during the public health emergency. And when we did that, we got an additional 6.2 increase in our matching rate from the federal government. Since March of 2020, DMAS and DSS have closely collaborated to implement flexibilities and protect needed coverage and to allow access to services. Of course, we started planning for the unwinding almost immediately because we didn't know when it was going to end, but we've been working on it all this time. And then of course, in April, we started actually unwinding things. Secretary Littell convened a monthly unwinding task force beginning in January 2022 to include DMAS, DSS leaders, and the Office of the Attorney General. In December of 2022, the Consolidated Appropriations Act was signed into effect, decoupling the PHE from the continuous coverage requirement. So effective March 31st, we were able to start doing our renewals and ran our first renewals electronically. We did have to put in a mitigation plan because we were not automatically doing renewals of age blind and disabled individuals. So we are doing that now, and that was a mitigation plan that we had to put into, just like 43 other states. Next slide. The end of the continuous coverage requirement in Virginia presents the single largest health coverage event since the first open enrollment of the Affordable Care Act. This is also known as unwinding. You'll hear that term over and over. Historically, we have experienced churn, which is enrollees who reapply and regain coverage shortly after being terminated. From March 2020 through March 2023, we experienced an increase of over 630,000 enrollees. That was a 41% increase in enrollment growth. The growth has been the fastest among the non-elderly, non-disabled adults, the expansion population, and slower among children and ABD groups. We expect that about 14% of our enrollees may lose coverage, and up to 4% may lose and regain coverage within 1 to 6 months of closure. The national average for loss is about 20%.
All right. So, we placed a lot of emphasis on making sure our systems are in place and enhanced in the areas that really need to be enhanced on. We made sure that we created modifications where necessary. And Kelly mentioned a couple of those before. But for us, we also created, there was a contract modification that was made to extend how Cover Virginia operates to include a redetermination call center. And what's beneficial to you for that is when you're working with our members is expanding their access to those people and walking them through that process is thoroughly helpful. And when we talk about long lines, or we're talking about the amount of time it may take to get in to see a caseworker, you're really happy that we were able to expand that service within the Cover Virginia operation unit. And that vendor is, Cover Virginia is expected to really process approximately 420,000 or a third of all cases over the next 12 months. And they have seen a tremendous uptake over it was kind of peaceful for a little while, and then things got a little rocky. But overall, it is going really well. This also includes our CRU unit, which is our incarceration unit, and this will allow for over 30,000 incarcerated enrollees to also receive those services and have processes for their materials as well. For outreach and engagement, we have been doing campaigns for over a year and a half. This includes over 1.1 mailings to letters to all of our different members, which also included a campaign to increase their knowledge and understanding of how we can access them, as well as making sure that their phone numbers and emails and mailing addresses are up to date. We have done radio ads, television ads, social media campaigns. Our websites have been updated and included a swath of different resources. And as you can see here, we have toolkits, templates. We've been doing provider memos and making sure that we engage our partners and stakeholders in all the ways that we possibly could in order to make sure that you as a stakeholder understand what is needed on behalf of our members in order to successfully go through this process. We held a summit in March, which was a wonderful opportunity for our stakeholders to come together. We did this in partnership with DSS, with the Virginia Association of Health Plans, VPLC, Virginia Healthcare Foundation, who is on with us today, and the SCC. And so we're really excited to be able to share with you all the different things that we've been doing and for you to access those resources.
So as Natalie said, we've been making a lot of preparations with DSS to help local agency staff be able to complete the Medicaid unwinding work. We've been doing training, informational sessions, work groups. We've requested additional waivers. We meet with the local workers. It has been every week, but now it's going to be every other week by phone. There were 23 system updates done to help the system more efficiently handle applications, changes, and renewals. And we're also doing increased reporting to meet federal requirements and allow closer monitoring of progress within the unwinding period. There was an e-learning developed with DSS that refreshed local agency on renewal processing. Many of them had only been employed within the PHE, so therefore they hadn't even ever done a renewal. Over 3,000 local agency staff have completed that training. We've also hosted subject matter expert-led webinars to focus on Q&A with the local staff to prepare them for this work. And over 2,000 local agency staff have attended these webinars, and these series will continue until the end of April. The MCOs and Virginia Marketplace, we've been working with them with our plans and with the Marketplace to have plans for 4 rounds of targeted member outreach across all modalities. We've implemented new data sharing processes to include addresses, closures, and closure reasons. So we work those reports every month. And we've collaborated with the SCC to ensure the smooth transition of individuals no longer eligible for coverage to other health coverage through referrals to the new Virginia Insurance Marketplace beginning in November 2023.
So you've heard about all the different ways in which we've made sure we've enhanced our processes, made better partnerships with our vendors. And so for us, when we talk about, and I said before, the outreach and engagement component, the communications component, we had 3 toolkits, and we were able to, 3 toolkits, we've had 4 toolkits, and we were able to do this over 3 phases. And you can see from here, the phase 1 started last year. It started very robustly in making sure that people can update their contact information. This is engaging every stakeholder that can possibly exist that touches any part of the, I say, Virginia Medicaid ecosystem. And then you have phase 2, which started in March of this year, also engages our stakeholders, but make sure our members complete all necessary paperwork and submit that back in, because we don't want anyone losing coverage due to any of those procedural reasons. And so for us, it's really important that we engage not only the members, but all of our stakeholders about what that process looks like and make sure that everybody completes that paperwork. And then you get to phase 3. And phase 3 is for any member who has actually lost coverage due to unfortunate what may be those administrative reasons or didn't complete the paperwork, we want to make sure that they get to the proper resources. If they've had, some great life events happen or something else, in order for them to no longer be eligible for Medicaid, we wanted to make sure they get the information they need to make sure they have access to health care of some kind. And so that's what phase 3 is about.
And this is just some of the numbers that we've collected so far. You will see that like the top squares are about the automated ex parte process. That's the beginning of the renewal process, where we run people through our electronic sources to see whether we can renew their coverage without contacting them. March, that was the first month we did it, and we had a really high success rate because we were only doing cases that had been that had applied within the last year. Starting in April, our success rate has been lower but very consistent, and we've been folding in each month some of the people who were overdue. So some of these cases have not been touched in several years. So that's why there's a lower success rate. But every case we're able to do through ex parte is a case where we do not need to send forms out to people and a worker does not need to touch the case. So as you can see, we've continued along. We've been working towards doing the same percentage of the total that's needed each month. And so we're at about 23%, I think, so far. So we're making good progress. We're on track to get all of our renewals done by the end of the period, unwinding period. Appeals are picking up as well. They might, because it's very confusing for people who have been on for several years suddenly now to lose their coverage. So we expected that and we stepped up for that. And then just requests for information, people sending things into DMAS. That has not gone up as high as we thought it might yet, but I'm sure that it will. Okay, Natalie.
So where can you get more information? For us, it's really important that you feel comfortable and you feel validated in your approach to how you're helping with this effort, because we need all hands on deck when it comes to this kind of work. And so for us, our member and stakeholder materials and resources lie on our Cover Virginia, Cooper, Virginia, and DMAS websites. They're a suite of good nuggets. And so if you go to each one of them, they're really easy to access. You'll see websites here, and this presentation will be made available to the Funders Network so that they can pass it along, and it's really easy for you to click and get there. But you can also Google is your friend, and you will see a number of different resources for our members and our providers. For the Cover Virginia area, you will see it under our Return to Normal section, and then for our DMAS website, you will see it under the COVID-19, or you will see it under some member sections where necessary in order for every demographic to access that information. Then you will see renewal status dashboards. They can be found on the DMAS site under the data tab, and it tracks our progress towards what we're trying to do, which is redetermine all of these members. And that dashboard is really, really important to a lot of our partners, so you can see our progress, see where some opportunities lie, and allow for us to engage in healthy conversations about what this process looks like. We also provide resources and information to our legislators, and that can be found at the website here. And it's just a lot of, it provides enrollment data as for the Virginia State House and the Senate districts, as well as our congressional districts, so that they know what they need to do with their own constituent base in order to help them through this process. So at the end of the day, we really want to thank everyone. We want to thank everybody that touches this process. Kelly and I do this every day. We enjoy our work. We're in the thick of it. We've been doing it for a while, but this is very normal for us, a version of normal for us, as far as like making sure that our members get what we need. This is the reason why we go to work every day. We found that to be a blessing and a benefit. But for you doing this kind of work, can sometimes be taxing. It can be sometimes confusing, and making sure that you have the information, that you engage in conversations with us, that you attend webinars like this, that you're able to ask questions is really important. And we want to thank you first and foremost for allowing us to come and share this information. We also want to thank all of our extended partners, a lot of them here today. Both of the speakers today are also our extended partners. They're in this with us and helping every step of the way and solutioning with us in order to ensure that our members stay covered where necessary. And if they ever need to be connected to other resources outside of the scale and scope that is Virginia Medicaid, that they can do so. So every partner that you see here and all of you that are with us today, we want to thank you and really appreciate you ahead of time for helping with this process. So we thank you for the opportunity to present, and we'll turn it back over to our facilitator for the day. Thank you, Avanel.
Yeah, thank you,
Thank you.
Natalie. Thank you, Kelly. What a wonderful wealth of information. We're pausing for a few minutes. I do need to keep us timely and on track, but I'm going to pause for a few minutes and see if there are any questions from the audience. To start, I think there's one, Natalie. We heard your call loud and clear, all hands on deck. Curious if there are any particular examples of a funder partnership that you've had already, or is in the works, or that you wish that you could have that would really help with these the efforts that you and Kelly described.
Well, I will actually say, because you're going to hear from next our partner Emily, and Emily and the Project Connect outreach workers, that is a partnership that is near and dear to us, because that really allows for us to have one-on-one engagement and support for our members. They can call into Cover Virginia, but when you get a Project Connect worker, you get somebody that's going to be with you through and through. They're going to help you navigate that kind of process. And so I will throw out a shout out for them in connection with our funding network, because when you're talking about helping our members, for us, we're about making sure you have the resources on hand. But those Project Connect outreach workers and a lot of other workers that probably exist through a lot of the organizations that they fund are really about that everyday encounter that they have with members. And so for us, it's really important that you access the resources, that your partners understand where those resources are. But resources like those outreach workers are really important, because our members often find themselves sometimes frustrated and have lots of questions, and they really just need a support system to help navigate through that process. And our outreach workers do a wonderful job of that. So I will definitely shout out our Virginia Foundation for Healthy. Oh my God, it's too many letters. I've already forgotten half of them. But anyway, I'll shout out them for making sure that our Project Connect outreach workers have what they need in order to support our members through this process, because we know it is a daunting one for a lot of them.
Thank you, Natalie. I think you sort of teed up our next part of the conversation here. So I'll go ahead and remind everyone who's on the call today, if you have any questions for any of our speakers, you can put your questions in the chat. You can, I think, also raise your hand, use the raise your hand function, and ask your question live. We are more than delighted to have Michelle Thomas. She is the SNAP Supplemental Nutrition Assistance Program Manager at the Virginia Department of Social Services. In our chat will be a more complete information about Michelle's bio. And with that, I will turn the floor over to Michelle.
Thank you so much, everyone, and thank you for having me speak today. You mentioned my name is Michelle Thomas. I'm the manager of the SNAP program in the Commonwealth. And today what I'm going to do is just give you a really high overview of some of the things we did during the PHE. And then I'm going to come back through and try to tie it all together about what we're doing after the PHE, including engaging our customers and some other things. I am going to pinch hit for my co-worker today, Mark Golden, who is the TANF manager, and just give you some high-level information on that as well, and some of the things they did in the PHE. Caroline, if you can move to the next slide for me. I think I pretty much handled this part of it. So we're going to talk a little bit about emergency allotments, which I think many of us know a lot about. Pandemic EBT takes some of that mystery away. Some of those very special provisions that were in place because of the pandemic. Going to give you a little background on some of the things that were happening with the SNAP caseload during this time, some of our post-PHE activities, our community engagement team, which I also manage as a part of SNAP, and just again, a quick overview what's happening in TANF and VIEW. Next slide, please. So why I think this screen or this particular slide is so telling is because this is probably the last 3 years of my life as a SNAP manager all balled up into one place. So if you can see some of these highlights and look at these numbers, then you know what SNAP looks like in Virginia. During the emergency allotments, which we started in March 2020 and ended in February 2023, we issued just in emergency allotments to our households over $2.5 billion a year. We've served just over 920,000 Virginians per month at our peak, and that peak was somewhere in about March of this year. We issued $2.1 billion in pandemic EBT benefits to school children and their families to support them during the pandemic. And just as a regular day on the street, during a regular year for SNAP, we issue about $1.8 billion in regular benefits. That's outside of the emergency allotments that I just mentioned. So that's what it looks like in Virginia in a given month. So we did something called waive the interviews, which was one of the provisions that we were allowed to do by the Food and Nutrition Services. And since March of 2020, have waived nearly 1 million interviews for our households. And what is amazing in that is that we have an error rate that is still well below the national average of about 2.5%. So we had a lot of work going on here, a lot of good work, and a lot of people served and benefited from our program. Just another word about pandemic EBT, or P-EBT as everyone else calls it. We served over 700,000 school children, probably closer to 800,000, but I didn't have the exact numbers so quickly. So we did a lot of touching folks out there in the streets, touching families and supporting families. Next slide, please. So for emergency allotments, essentially all that was that for those who were already receiving SNAP, you received an additional amount of money each month up to the maximum for the household size that you have. Households didn't need to apply, they didn't need to do anything. We just loaded their cards for their regular benefits on the one of the first 7 days of the month, and then about the 16th of the month, we added additional benefits. This again was not something that any household had to ever apply for. The state of Virginia, I submitted an application or a request to FNS each month to have these benefits issued, and we did it behind the scenes for our households. Again, you saw how much money we were issuing to households. It was probably one of the best things that we ever done that I can remember. And I've been in the SNAP program now for over 25 years, that across the board, I could actually see how this helped folks, especially some of those folks that you all may know that receive that minimum allotment that's about $20 or $25 that nobody ever wants. So this really did give a boost to families during this time. The pandemic EBT benefit that we received, or that we gave out on behalf of Virginia Department of Education for school children, really was a nutritional benefit. And it was meant to support families whose children were automatically at home. And if your kids were anything like mine, they were eating you out of house and home. The difference between a pandemic EBT benefit and an emergency allotment is that pandemic EBT had nothing to do with anyone receiving SNAP. Actually, probably only about 1/4 of that almost 800,000 children that we mentioned that received pandemic EBT were actually recipients of SNAP. Most of the folks were your neighbors, maybe some of you who have children who are school age and met the qualifications of one of the 4 rounds that we issued during that time period in Virginia. So pandemic EBT and emergency allotments were the backbone of trying to help families through this rough time in the last 3 years. Next slide for me, please. So let's talk a little bit about those SNAP temporary provisions, just a little bit. So there were provisions that were given by some bills that happened that gave higher education college students some temporary eligibility criteria. They weren't huge things, and to be honest with you, the SNAP, the policy around students and SNAP is so stringent and really has not been touched since I think about 1978. So even though we were helping and trying to get more children, more adults, young adults that are in higher education or in college to be eligible for the program, we are working with some very antiquated policies when that comes along for that. Another thing that we were able to do is to waive certification interviews for our households. That was optional for our 120 localities. About more than half of them took up that option early into the pandemic. As we moved through it and applications became a little bit more stable, some went back to interviews, but many did not. Most of the larger localities did continue to waive the interviews. So about anywhere between 60 or 65, a little bit more than half of the 120 agencies that do SNAP and across the Commonwealth are waiving those interviews. So again, that was an option for them. Not everybody took that up. Probably the hottest topic on the streets right now is the time-limited benefits for SNAP work requirement. It was temporarily suspended in March of 2020. Again, it lifted effective for 4/1 of 2020. That said that you could only receive benefits for a short amount of time if you did not meet one of these exemptions. It has gone away. Most of us expected that the PHE would have lasted only a few months, but 3 years is a very long time. I think Kelly mentioned that a lot of the folks that we even employ now have never worked a case that has a person that has time limited benefits attached to it. So as we're moving back towards that, and we did actually on July 1st, we did do quite a few things to get everybody ready for that and some readiness and also some customer education. So summer food benefits were also issued. It was a part of P-EBT. It wasn't necessarily something that everybody saw as verbally as they saw the regular benefits that we were doing during the school year, but we did offer a one-time benefit for summer P-EBT to many children across the state. So that also was one of the temporary provisions that were given. You can get me the next slide, please. So this data here is just so you can get a quick view of what Virginia has looked like since 2018. And if you see the caseload that it was about 349,000 households, that's not people, that's how many households were receiving benefits, up until a high of about 461. Actually, our high was more close to 470,000, but we've had a slight decrease in our numbers since we went back to the essentially regular programming in March of 2021. Not a lot. I know a lot of people thought, March of 2023. I know a lot of people thought it was going to be this drastic decrease in families that were receiving SNAP, but it actually was not. We grew from August of 2020 until now about 27 or 28% in our caseloads. And what I think is also very interesting about our households that I love to share with folks is that most of the folks that receive SNAP are folks that work every day, and most of our households have children attached to them. So that's a whole lot of folks. Personally, I believe the one thing that made it a lot easier for people to receive benefits at this time and to keep our caseloads high, thus these folks are eligible, is the fact that we didn't have an interview. So what we do, we still have contact with households, but it made it a lot easier for people to actually apply for benefits, receive benefits, and just clarify information through a phone call or through mail if they needed to do that. So we try to make it as easy as possible for the folks to get to the benefits. And again, despite what lots of folks believe, we really did not see a big, huge problem in our fraud rates, or that we saw a huge problem in cases are being done incorrectly. So we actually think on the SNAP side of this might have been a win for us, because FNS, the Food and Nutrition Service, is notoriously conservative when it comes to such things as interviews and others. So what we do with this kind of data that you're seeing before you is really, it helps us look at what are our policies and what options could we use in order to enhance the program. It also, for folks that are just random people or even us, it helps us to monitor the current economic conditions that support this, because generally what folks think is if the SNAP caseloads are up, then we have some economic work that needs to be done. It also measures the success of our access initiative. So we do have some outreach activities that we do, and we have some we have a very vigorous outreach plan, which is an option for a state. We're not required to do that, but Virginia has done it for approximately 15 years. So we do use this to help us to look at this information. And we also look at it to help us identify possible gaps in delivery and how we could message better to folks that may potentially be eligible for benefits, or even to those who are currently receiving our benefits. Next slide, please. So let's talk a little bit about our post-pandemic activities. So officially, the interview waiver was attached to the pandemic, but FNS USDA provided states the option to take a waiver for 1 year through May of 2024, May 31st of 2024, to continue to allow us to waive the certification interview. Because it has been so successful here in Virginia, we have decided to move forward through that, and we do still have approximately those same 60 to 65 agencies that are waiving that interview. The reason I use that 60 to 65 number is because they can stop waiving the interview or opt to start to waive the interview at any time. So we're taking care of this, and it is ebbs and flows, but generally we stick around 60 or 65 that are doing it. It also established, and I have a SP here, it also established a permanent summer EBT program that's for school-age children that begins in 2024. So we are looking at working with our partners in the Virginia Department of Education about how we permanently put a program in place that helps children in the summer and families. This benefit is a little different than what we're accustomed to, because there is a set benefit that is per child that is eligible to receive it. There has not been a lot. The regulation was passed in December of 2022, but we have not really received those that how do you put it in place type things yet. So we're still in discussion with our partners at Virginia Department of Education, because while we will be using the SNAP infrastructure to issue the benefits to households likely, this is a nutrition program that is going to be run under the Virginia Department of Education. So there is also a focus on SNAP education and training, which is SNAP ENT, and that reinstatement came with the work requirement. What is that? That is basically a program that says, hey, you can either volunteer to work with us, or if you are someone who is subject to work requirement, you can come over and learn how to get some additional skills, come and use infrastructure to see what we can do to help you to ready yourself for work. And it's a great program. It has been expanded, and it is actually probably going to get a little bit more funding coming through as we have more of a focus on training folks and making sure they have the educational components in order to get good jobs that allow them to not necessarily use the safety net for a long period of time. We also have a SNAP community engagement team, which, as I mentioned, I manage as well. And what that team does is to support our partners who have SNAP contracts with the Virginia Department of Social Services to outreach to our customers, or to not only outreach to our customers or potential customers to maybe come in, receive SNAP or apply for SNAP, or to learn more about how to get nutritious foods and things of that nature in their localities. And that, so we have a very robust community engagement area, and we are always looking for partners, and we'll be doing some more with some outreach conferences and maybe some Q&A with folks. So if you're interested, I certainly will share that information with Virginia's funders when we're ready to kick it off, and they can share it with you all, and we would love for you to participate in our outreach conferences that are scheduled tentatively coming up in October of this year.
For elevating Debbie. Debbie, we're so happy to have you here so you can step in for Emily. Debbie is the CEO of the Virginia Healthcare Foundation. Debbie, we have about 4 or 5 minutes before we need to go into breakout sessions. So if you didn't mind running us through the highlights here. Thank you.
Sure. And hello, everybody. And we apologize for the technological problems. Emily is our guru, and it's a shame that she isn't able to provide you with this information. So I'm a poor substitute is what I would say. So it really boils, I can do this pretty quickly. The Healthcare Foundation is involved in maximizing enrollment in the Medicaid programs and CHIP program, really by two main mechanisms that Emily had mentioned. One is through funding outreach workers. We have 21 of them at this point, a number, and they're strategically located around the state. And a number of you have funded some outreach workers for this work over the previous years. And we thank you very much for that, especially around Medicaid expansion. And then again, COVID and all the people who lost jobs at the beginning of the pandemic. The second is what is on this particular slide, and that's through our Sign Up Now workshops, which really, they're each about a 4-hour workshop that we used to do in person and all around the state, and now we do virtually. We also have an on-demand version with modules, but this is to train people in various community-based helper organizations around the state about Medicaid, walks them through the application, how to help people who might be their patients or their clients, that kind of thing. We, for years, have had what I think of as our regular Sign Up Now workshop, which is for what I think of as regular Medicaid, what we would all think of as that, in preparation for the unwinding or the renewal, resumption of renewals. DMAS asked us if we would also create one specifically for those who are age blind and disabled, because that is a whole different set of regulations and complexities. And so we now have both types of Sign Up Now workshops, and people can go online to our website and sign up for them. There's a whole toolkit that comes with them, that kind of thing. Next slide, please. And I should say, while we're moving to the next slide, that a lot of you have funded Sign Up Now workshops in your region or service areas over the years as well. And so we thank you for that partnership. Now, with the resumption of renewals and the all hands on deck approach, in addition to what I just mentioned, we have we issued a special edition of our Sign Up Now newsletter. We have the theme kind of like Paul Revere when he was warning that the British are coming, the British are coming. We've been warning that renewals are coming, renewals are coming. And so we have a special edition of our newsletter, which has been shared on the VFN website and links in the newsletters. Also, we've made presentations to lots of different folks around the state. That would be the editorial. Emily has done that. And we've created renewals are coming buttons, both in English and Spanish. And so we've got that. And then we've been doing this really ever since the CHIP program started years ago. But for all of our grantees who are working in, who are in healthcare settings, which is the vast majority, we have an objective that they will learn how to help people who are eligible with their Medicaid applications and track what they're doing to help us. And so those are some of the things we're doing. Next slide, please. And this is the last slide also. And I did want to answer your previous question, Avina, and that is I think we're aware that a lot of our partner foundations are doing things in their communities, whether it's talking to their local DSS to see what the needs are and figure out how to, help there, or with the local hospitals or safety net organizations. And I know Harvest Foundation, I'll give a shout out to Harvest, hosted a Medicaid mixer recently to help give everybody bring all the local organizations together to talk to their local DSS. And then others have talked to, for the few places that still have newspapers, their local editorial boards and opinion leaders. And so you see some examples here. So those are some of the things that we've been trying to facilitate, as well as some of the highlighting some of the things that we're aware of that some of you are doing. Happy to answer any questions.
Thank you, Debbie, so much, and thank you for flying through that so that we can keep back to schedule. Happy that we had you on the call to step in for Emily as we lost her to some technology difficulties. All right, so now for the next 30 minutes, if you have any questions, I'll just say really quickly, you can feel free to put them in the chat, or if you have anything you want to ask live, you can raise your hand and you can see that that your question gets answered. For the next 30 minutes, we'll be in the regional breakout rooms where we can dive a little bit deeper into the regional context and connections. I hope everyone enjoyed those breakout discussions. If like our group, you might have been cut off mid-sentence, sorry about that, but it is time for us to come back and just do a really quick recap of these breakout sessions. So the purpose here was to just dig a little bit deeper, make some connections on a regional level. Maybe we can have the moderators, anything that you learned that you'd like to share? Maybe one of our moderators can
I can start.
In. That'd be great. Thank you.
Yeah, thanks, Abigail. So hi, this is Sarah Hashmal. I was in the Northern Virginia group. We had a really interesting discussion that went in a direction I wasn't expecting, speaking about the Community Link program out of the Path Foundation, which is kind of like, now you all can tell me if I do a good job, but like a 211 or a 311 plus case management that's very community informed, driven, and has a lot of communication chains back and forth, and how important that referral network and information network for a community is, especially as we're approaching or experiencing unwinding. So that was a really big piece of the discussion, was how do we help people navigate that and know about what resources are even available in a community. Thanks.
Yeah, that was great. I was a part of that group too. Very fascinating conversation. Anyone else want to highlight something that was really interesting or something new you might have learned in these breakout groups?
This is Valerie. I think going with what just Sarah said, I think one of the things that we landed on when we talked about, and our conversation didn't go as expected either, but when we talked about what can we as foundations do to help, we kind of landed on how we can build capacity with organizations using some of the resources that the foundation have, whether it is lunch and learns, of using the experts that we had to hear today that guided the conversation, because many of them shared a plethora of other resources they have in addition to what was shared with the group as a whole. And so we realized there's some things that we can do to continue that relationship and continue that information sharing in our respective localities. So that was good information to get.
Thank you, Valerie. And Jessica, I saw you come off mute shortly. We got 30 seconds.
Yeah, just my group talked about the importance of delivering the message kind of over and over again over the unwinding period, and then using existing networks, whether it be kind of faith-based organizations or food pantries that are linked to one another, making sure they have the information so they can talk to their clients and folks they interact with every day about this.
Yeah, thank you. Power of repetition. Wouldn't be doing my job as moderator if I did not end us on time. So with that, I am going to turn it over to Robin for some just closing logistics.
Great. Thank you so much, Abigail. And thanks to everyone who participated in this session today. We hope you enjoyed it.